Hello everyone, my name is Mary Inman. Today I'm going to discuss the evolution of health insurance in the United States, the Affordable Care Act, the American Health Care Act, support or opposition of components of each, and lastly discuss healthcare as a right. Historically, healthcare financing in the United States began with out-of-pocket payment and progressed through individual private insurance, then employment-based insurance, and finally government financing for Medicare and Medicaid. Before passage of the Affordable Care Act of 2010, it is important to understand that there have been many failed attempts at national health insurance in the United States. Let's discuss some of these failed attempts first so you can better understand how passage of the Affordable Care Act is a large milestone for the United States. According to Bodenheimer and Grumbach, 2016b, in the early 1900s, 20 to 45% of people who became sick did not receive any medical care. In 1915, the American Association for Labor Legislation published a national health insurance proposal to provide medical care, sick pay, and funeral expenses to lower-paid workers and their dependents. Ultimately, this first attempt at national health insurance failed. According to Bodenheimer and Grumbach, 2016b, in 1943, the Wagner-Murray-Dingle Bill was introduced, which was based on a Social Security system enacted in 1935. It was a social insurance proposal. Working people and their dependents were eligible because they paid into Social Security prior to their retirement. The permanently unemployed were not eligible. Employer and employee contributions to cover physician and hospital care would be paid to the Federal Social Insurance Trust Fund, which would in turn pay health providers. In 1950, this attempt to national health insurance failed as well. According to Bodenheimer and Grumbach, 2016b, in the 1950s, less than 15% of the elderly had health insurance. The Medicare law of 1965 used the Wagner-Murray-Dingle approach to national health insurance, but it only applied to those that were 65 and older. Medicaid was also brought into law in 1965 to help cover a portion of low-income population. Although a step was made towards national health insurance, there were still many people left uninsured in the U.S. According to Bodenheimer and Grumbach, 2016b, in 1970, Kennedy-Griffith's Health Security Act attempted to combine social insurance and public assistance approaches into one unified program. This attempt failed as well. According to Bodenheimer and Grumbach, 2016b, during the 1980s and 1990s, the number of uninsured rose from 25 million to 40 million people in the U.S. 3/4 of these uninsured were employed or dependents of employed persons. In 1993, President Clinton proposed a plan that would require employers to pay for most of their employees' private insurance premiums. This attempt failed as well. Finally, in 2006, the U.S. made great progress towards national health insurance. According to Bodenheimer and Grumbach, 2016b, Massachusetts enacted a state-level coverage bill implementing the nation's first individual mandate. This mandated that every state resident have health insurance meeting a minimum standard set by the state or pay a penalty. This plan set a stage for a national plan enacted under Obama after his election in 2008. The Affordable Care Act was signed March 23, 2010. It has four main components to its reform for healthcare financing. These four components include individual mandate, employer mandate, Medicaid eligibility expansion, and insurance market regulation. According to Bodenheimer and Grumbach, 2016b, about 15 million people have been newly insured under the Affordable Care Act, half through Medicaid expansion and half through health insurance exchanges. However, there are issues with the Affordable Care Act. Therefore, the American Health Care Act has been introduced in attempts to repeal and change some of those components. Let's talk about the American Health Care Act first, and then we will dive into some components that I support or oppose from each system. Speaker of the House, Paul Ryan, 2017 states, the American Health Care Act has four driving principles that it is focused on, which include lower cost, more choices, patient control, and universal access to care. This act attempts to repeal the Affordable Care Act and its taxes, spending, and mandates. This act states Medicaid needs to be governed by the states, not federally. There needs to be lower cost premiums for the healthy. Coverage needs to be provided to those with pre-existing condition using risk pools. There's a need to expand health savings accounts. And lastly, there's a need for refundable tax credits. Now I'm going to discuss some components I support or oppose from each system. One component I support with the Affordable Care Act involves pre-existing conditions. According to Rowland, 2015, a pre-existing condition such as cancer made it difficult for many people to get health insurance before the Affordable Care Act. Most insurance companies wouldn't cover treatment for these conditions. Under the Affordable Care Act, you cannot be denied coverage because of a pre-existing health problem. According to the Department of Health and Human Services, 2017, between 2010 and 2014, the share of Americans with pre-existing conditions who went uninsured all year fell by 22%, meaning 3.6 million fewer people went uninsured. That is many people that were positively affected by this component of the Affordable Care Act. Another component I support with the Affordable Care Act involves the individual mandates. According to Health Markets Insurance Agency, 2017, Americans must enroll in qualified health coverage or pay a tax penalty, and individuals can apply for coverage exemptions. According to DeBow, 2017, individuals will not be required to comply with these mandates or be charged penalties under the American Health Care Act. Instead, it would create a 30% premium surcharge for individuals who did not have continuous coverage for more than 2 months. I oppose this repeal of the American Health Care Act. According to the Henry J. Kaiser Family Foundation, 2016, health insurance makes a difference in whether and when people get necessary medical care, where they get their care, and ultimately, how healthy they are. Uninsured adults are far more likely than those with insurance to postpone health care or forego it altogether. The consequences can be severe, particularly when preventable conditions or chronic diseases go undetected. Therefore, by mandating everyone get coverage, preventable illnesses and chronic diseases can be detected and controlled better, creating better healthcare outcomes and costs. One component I support with the American Health Care Act involves the employer mandates. The American Health Care Act would reduce the employer mandates penalty to $0. Currently, the Affordable Care Act requires all employers with 50 or more full-time employees to offer qualified health coverage. If they do not, they must pay a tax penalty. According to Rowland, 2015, the number of full-time jobs has increased in the recent years, but there are still reports of businesses cutting hours from employee schedules. Businesses with 50 or more full-time employees must offer insurance or make payments to cover health care expenses for their employees. By reducing hours, businesses can get by the 30-hour per week definition of a full-time employee. According to DeBow, 2017, many employers will still provide affordable health insurance coverage under the American Health Care Act because they want their compensation packages to be competitive and they care about their employees' health and well-being. Therefore, if a company is not forced to pay insurance, then less jobs will be cutting employee hours. The last component I want to talk about involves Medicaid. I oppose the American Health Care Act to discontinue expansion of Medicaid. According to Flowers, 2017, $880 billion in Medicaid cuts would be seen by 2026 if this repeal is passed. Many people will be affected by these cuts. According to Ranji, Salkinkoff, Sobel, and Reswing, 2017, 11 million adults gained coverage as a result of the Affordable Care Act's Medicaid expansion. According to Families USA, 2015, cuts to Medicaid would affect seniors and people with disabilities, long-term care, children's health care, women's health care for parents, health care for working families, and weaken healthcare infrastructure. Flowers 2017 states, rather than take billions of dollars out of Medicaid and shift significant costs to Medicare, it is time to have a reasoned conversation about how to improve the program in ways that don't leave gaping holes in the healthcare safety net that millions of people and their family caregivers rely on. To conclude this presentation, I would like to answer the question, is healthcare a right or is it a commodity? My personal belief is that healthcare is a right. Being in the nursing profession has allowed me to empathize with patients and their healthcare needs. I believe no one should be denied access to health insurance coverage, primary or preventable services. According to Bodenheimer and Grumbach, 2016a, healthcare is regarded as a basic human need by most people. A quote from Margaret R. McLean, 2007 states, "The inherent dignity of human persons requires that people be treated with dignity and respect, which includes the fulfillment of the basic need for healthcare. Health is a fundamental good necessary for human flourishing, and healthcare is a fundamental human right. Because healthcare, at its best, promotes and sustains human health, society is obligated to provide access to basic quality health care for all of its members." In my opinion, the Affordable Care Act has made a great leap to make health care a right for the citizens of the United States. With that stated, I still feel that there are changes that could be made to the healthcare system because no health system is perfect. As a nurse and future nurse practitioner, my hope for the future of healthcare is that we move past our differences and focus on providing optimal healthcare resources to those in which we serve. Thank you so much for taking the time to listen to this presentation. Any input or advice or comments are greatly appreciated. Thank you.